Welcome to Changemaker Chats, a series about passionate people working to change our region into a community where everyone thrives. I'm John Wilgers, President and CEO of Greater Twin Cities United Way. In this, my inaugural episode, I'm talking with Changemaker Amal Abdalla, President and CEO of Somali Success and a United Way nonprofit partner, about her commitment to the economic vitality of the local East African immigrants. So, Amel, thank you for joining me this morning. Why don't we begin by you talking about Somali Success?
Good morning. Somali Success School is a nonprofit organization that was created by former refugees, new Americans, to assist new refugees to get assimilated and get jobs, education, and economic vitality in Minneapolis. We started this as a one classroom program in 1998. I was the teacher and the creator, and it has grown today as the largest adult basic education provider in Minneapolis. We serve an average of 120 adults and families a day, and our programs are designed by the community we serve, are reflective of the community we serve. We have a plan to not only teach and advance the social and economic status of immigrants here, but also to be a change maker ourselves by hiring them, training them, and allowing them to be in positions of power and decision makers. So we're basically a conduit in which new refugees can come and get the space, the attention, the support, the education, and the advocacy to become self sufficient citizens. We provide language training, we provide workforce training. Most of all, we provide civics and life skills training on how to live in America, how to navigate the system so that you can send your kids to school, become a homeowner eventually, become a citizen. We help people with citizenship classes and become a voter and vote. So the idea is to take people from the beginning when they're just arrived and they're really kind of needing a lot of assistance to navigate the system, all the way to professionals that we hire because we think it's important as change makers to have somebody who looks like the community in positions of leadership.
So, 2020 has been a interesting year, a challenging year for everyone. Probably nobody more than people leading nonprofits like Somali Success. So when you look back at 2020, talk about how your organization has changed in order to be able to, well, first of all, continue to serve the community that you serve, but also in order to be able to survive.
Because we're an adult education provider in Minneapolis, we were hit really heavily by as far as our classroom teaching. We were shut down in March along with the school district. We follow the school district schedule as far as our adult classes, and that has become the least of our issues, to be honest with you, because we were able to keep the education going in long distance manners. We were creative because not everybody in our population, and especially the clients we serve, are not IT literate. They do not have access to personal computers. So we had to have an immediate and very drastic changes to our programming. We provided tablets for all of our students. We made sure that everybody was connected and able to open up a Zoom class so they can follow the instructor that's teaching from home. It has been a very stressful position as far as finances goes because, as you know, if you don't have classrooms, it's really hard to keep it. And because we hire former refugees and we want to be the example of giving somebody a chance, regardless of their accent or maybe their grammar not being perfect or English not being perfect. that has affected our staffing. We had to lay off some staffing that has been with me from the beginning. The average Somali Success employee has been there an average of 8 years. Most of them have been there with me the last 19 to 20 years and created a program. So that was a very painful decision we had to make. The COVID-19 has disproportionately affected our population. We have so far lost 7 students to COVID-19 in Minneapolis. They were elderly, and one was in their 50s that became very sick. As you know, myself, I was hit very hard in our family. My mother and my older brother both ended up in a um, attacked by COVID and in a ICU on ventilators for several weeks. So I felt it very personal, and I felt it all around us. The good thing about it is that it was a way for me to learn firsthand what's needed, what's not out there, even what to ask. This is a novel coronavirus, even for the community at large. So you can imagine the importance of educating our community as far as seeking health care right away, not waiting, breaking the stigma of hospitals because a lot of immigrants were afraid to seek health seek help at the hospital. The idea being that if you go to the hospital, you will be put on a ventilator and you will die. We have created a program where we provide um, guidance and advocacy for people who have loved ones in hospitals. We work with the couple of representatives from the community, Mohammed Noor and Hodan Hassan, to create groups where he brings together the Healthcare Association of Minnesota, various hospitals like the University of Minnesota, which has Bethesda, St. Joseph, COVID-19 hospitals. And I've been working strictly to guide them and tell them what I have experienced personally and what we have experienced from the community, what the needs are. I wanted to be the that helper that needed when I was new. Obviously, I didn't speak English, but I had an education, and our programs are created literally to help the needs of the immigrants, whatever they would be, whether we can help them directly or in partnerships with United Way or entities.
I think it is so great the way you've taken a education and a workforce development organization like Somali Success and pivoted to add this element of health education to it that's valuable to the community. And like you said, I know your uh, personal experience has been very real and very painful,
Yes.
and yet it has provided you the perspective to be able to serve your community in ways you otherwise might not
I
have been.
wouldn't have even thought of it. Yeah, absolutely.
Right.
I, it sounds weird, but I'm grateful for the experience because it allowed me to help individuals that call and have basic needs that are not being met. Like, how do I talk to my doctor, my mom's doctor? I don't know how to talk to them. So, in a way, it has created the need, but it also has created all that education that I received and had to get myself. So, yeah, it's everything bad can bring something new in life. I mean, the Civil War created refugees. I wouldn't be here if it wasn't for that. And I honestly think that every lesson is something that you can share with others. And I see that as my role as a change maker, making sure that whatever I learned, I can pass it on for somebody to create something even better and greater, maybe.
So I think COVID-19 is far from being behind us, but
Yes.
let's look ahead for a little bit. Look ahead, and having gone through the last 7 or 8 months, what when you look ahead, what gives you hope?
What gives me hope is that we were able to create solutions with very little. We had organizations like United Way that were proactive, that provided funding without us actually asking um, in unusual ways. We have partnership with funders that have the ability and the will to listen and make a difference. And I really thank you, John, for your leadership with United Way, because it has been one of the biggest supporters in a very, very dark time. We wouldn't have made it this far. I do perceive a shift in our services. The unfortunately, the economy is not the way it was anymore. And as you know, the lower level education people are the ones that suffer the most. They're also the ones that front lines in at the hotels, housekeeping. We have check-in people at the TSA at the airports. So these are frontline employees that have lost their jobs, and we are grappling with this big solution that we need: create new jobs in a under the time of COVID-19 for people who already had a hard time securing an employment that was family sustaining. So we are working hard to create long distance training for carpentry, construction, and healthcare, especially community health workers, because those are essential to educate and keep the community safe. Not only Somali community, but the African American community, the minorities, and indigenous of Minnesota.
Amel, thank you for the conversation,
Thank you.
and thank you for being a change maker and for working to create a Twin Cities community where everyone can thrive regardless of their income, their race, or their place.
Thank you for your great partnership. We couldn't do it without you. Thank you, John.